SA Anaesthesia stands for SurgiNet App Anaesthesia, and this is the program that we'll be using to document all our intraoperative data. This is the app that we'll be using. What I want you to do is I want you to click on here. Once you click on the app, it'll bring you up to this search function. You can cancel the app and it will bring you back to the home page. So this is the home page that you will see. If you select a case, it will bring you back to that first page that you saw. So what you want to do is you want to search for your theatre list, and to do that you want to make sure that you are in the right area. For example, if you're working at BRI, you want this defaulted as BRI. If you're working at St Luke's, you would need St Luke's to be defaulted, and then it will allow you to search. This is a common error where people get stuck on. So if you are working at BRI, make sure your base filter is BRI. And then I know that I am working in Bronte 2 theatres, and it's today's date which it defaults to. So I click on here, the binoculars, I go to intraoperative, and you'll see our list of theatres. I will click on BTO2, so Bronte 2, click OK, and then I search, and it will bring up the list of the patients which have been scheduled to my theatre today. And as we know, I've got one patient for today. It's already highlighted it for myself, and then I would then click OK. You can always filter by MRN, patient name, MRN, anaesthetist, make sure you've got the right date as well when you're filtering. So I've got the right patient, and when I press OK, it's going to then take us through here. So this is our double check. The first check is I'm clicking on the right patient. The second check is here, and this is basically saying, are you sure you want to collect data against this patient? Please make sure you are doing the double check, because if you do click on the wrong patient and collect data against that patient's record, unfortunately that is very difficult to dissociate, and it will result in a Datex or an iris because information has been stored on the wrong patient. So always make sure you are double checking with this 2-stage process. So this is my right patient, this is all checked, I'm happy, I click yes, I'm happy. Once you've clicked OK, this box will appear. Let me make it a bit bigger. What you'll notice that on all the Mindray or the monitors and the anaesthetic machines, you'll see a code associated to that monitor. Okay. What this page is asking you to do is it's wanting you to link this patient's record with the anaesthetic machine that you are using. So I would look at my code and I would see that this is the code that I want. So I would click on this and I'd press OK. And what I'm doing now is I'm associating the anaesthetic machine to this patient's record, so all the data that I pull will pull from the machine into the patient's record. If you click on the wrong monitor, you will pull data from another patient into your record. So this is something, again, you need to make sure you're clicking on the right data. Press OK. Once you've pressed OK, you'll be this first box will crop up, and this is called the continuing orders section. Any medicines, infusions, doses that have been given on the ward or are due to be given will crop up here to let you know that, for example, this patient has had paracetamol and it was given 30 minutes ago. You would see that it was given 30 minutes ago. So this is a safety mechanism. Cancel that, and this brings us on to our home page. So this is our SA Anaesthesia home page. It looks very busy when you first see it, but what I'll do is I'll go through each of the sections in order so you can get a bit more of insight of what they actually involve. So the first section you'll see here is up here. Selected cases will bring us back to that first page in SA Anaesthesia, where you can select a surgical case, so you can ignore that here. You can also ignore views. Finalising the case, as we'll go on to later, and that's how we will finalise and sign the case, so it uploads into the patient's power chart. You can ignore signatures as well. That's where you double sign for any documents or drugs that are given. That's mainly for our American users, and we don't tend to need to use it over here. Suspending a case is useful if, for example, you are doubled up with a trainee and a consultant, and the consultant is going to, say, leave for a bit, and the trainee and you are logged in on the consultant's login. This will suspending the case will allow you to log out of the consultant's record, allow the other clinician to log back in, and so anything that is documented will be documented under the name of the actual clinician who's giving the drugs, which will be populated into power chart. Changing the user you can ignore as well. Macros are a very powerful function. It's a group of interventions that can be grouped together to allow you to document information quickly, and I'll talk about macros later. Continuing orders is that first box that you saw when we logged onto SA Anaesthesia, so there are all the drugs that have been, or medicines that have been given on the ward. Medications, intake, output and actions. So there is 4 things that you can do on here. Okay, you can put things into the patient. This document things coming out of the patient. You can give any medicines, and anything else will become an action. So inserting an NG or an epidural or a catheter, they all form actions. And as you can see, these 4 things here look exactly the same as these 4 things here. Okay, so what you see down here is exactly the same as what's up in here. Inventory you can ignore. Clinical staff is adding your name or another clinician to the case. You can ignore here. Med and fluid review. This will give you a list of all the medicines with the specific time and doses which was given during the case. If you click patient's record, it will then take you into the patient's power chart record, which is really useful for documenting post-op analgesia prescribing. You can ignore recording mode. And monitors allows you to add or remove specific monitors during the case. Very quick run through of here. You'll need to play with them when you start using the app, just to understand them a little bit more. Your blue box is lots of information about the patient, so do double check this is the right patient. Monitors is a section here, and once you've associated to the monitor, you'll see a nice green dot, and that means it's pulling information. If you see a cross through it, like we've got now, that means that you are not associated and you are not pulling data, and this is because we're in a mock domain and I am not pulling data. So what you always want to make sure is that's a bold green dot. ASA classification. Now this is pulled through when they are seen in the pre-anaesthesia assessment clinic. This is coded and pulled through here, so if that is incorrect, you can click on the arrow and you can change it to whichever ASA classification you believe is correct. Again, anaesthesia type is pulled through when a surgeon requests a procedure. So again, if it's not a general anaesthetic, or it's a general anaesthetic and a regional, you can click on that, or you can click on neuroaxial. Just make sure you are on the right type of anaesthetic, as this will pull onto your chart. The next thing to be aware of is this section here, which is the allergy status, height and weight. This will only pull through information if it's been accurately recorded in the power chart. So you really want to make sure when you're doing your pre-anaesthesia assessment that the allergy status is accurate on the power chart as it is pulling it in here. Something to bear in mind is the height and weight. It will pull through the most recent height and weight for the patient. So you have to bear in mind that if you are doing say a paediatric list, it will pull through the most recent height and weight. But if that was added 6 months ago, then you will have an inaccurate height and weight. So always make sure that, especially when doing paediatrics, is that the height and weight for today has been recorded and it has been added into power chart by the nurses or by yourselves, because it will pull through that most recent height and weight. So just that is something to really be aware of. Okay, let's move down into this section here. Like I was saying, the medications, which is listed here under categories. So let's just take muscle relaxants. You've got all your muscle relaxants there. You've got all your non-opioid analgesics. So that's medications, which is the same as medications up here. Okay. This functionality is more powerful than this functionality, because up here, if you click on medications, it allows you to modify any administration, remove any medication, but you can quite easily use whichever aspect you want. Again, it's the same with intake. So if I click on intake, we've got all the options available, which are exactly the same as if I click on intake here. You've got all the options available down here. Again, that's the same with output, and it's the same with actions. Again, actions are classified under all these categories, which are the same as the actions here. So you can have a look under categories, or you could document an action on here. Once you start using the system, you'll understand what these actions mean and how to document. Right, we're moving down to this bottom left, which is a to-do list. And at the moment, we've got nothing in our to-do list. Okay. What you want to do once you've got your case open is that you need to, and associated to the monitor, you need to then tell the program what information you want to pull. So the way that we've done this is we've created macros. So as soon as you've logged onto the computer, an SA Anaesthesia, go to macros. Okay, you can see these are my personal macros, so you can make bespoke macros for yourself, and you can pre-fill all these macros to help you document information really, really quickly. And I have personal macros, I have additional personal macros. When you log on, you will see these two categories, which is general macro and additional general macro. You can then create boxes for yourselves. So general macro, say we are doing a general anaesthetic and it's a volatile. So you'll click on that, your anaesthetic technique, and it'll give you this big long to-do list. And this is basically a list of all the medicines, the most common medicines that you give during the GA volatile. And it also, you see at the top, I've pulled through all the observations and all the data that you want to pull through onto your anaesthetic chart. Okay, so this is the same as the to-do list. So once I've clicked on all this, I want to execute. Okay, and can you see it's already, it will, as soon as you execute it, it will then start pulling data from the machine. So you have to tell the program what data you want to pull. So can you now see my to-do list here has now been populated, which is exactly the same as that list that you've just seen. And the to-do list is in order of an anaesthetic. For example, you skip generally the bits about starting, peripheral access, monitors and safety, then you intubate or use a supraglottic airway, is the eye protection, NG tube, all the drugs for induction, some fluids on there, you've got some muscle relaxants, you've got some painkillers down here, and then towards the end of your to-do list you've got bits about positioning, thermoprophylaxis, VTE prophylaxis, things like that, and anaesthesia stop. Once you've executed this, it will start pulling data. Because I am not associated to a monitor, it's not pulling data, but you would see data pulling through here. So we're down here again. Let's continue moving through the page. That's our to-do list, which we will work through. Documentation brings us into this section here, which again, like I said, is exactly the same as this section here. So the 4 things that you can do is you can input, you can output, you can prescribe medication, and you can do an action. Okay, if we want to go back to our to-do list, it's there. If I want to set a reminder, then I can click on here and I can say reminder of check glucose. And I can say I would check that in an hour, and if I press OK, I can set a reminder. So in 1 hour's time, it will pop up and say check glucose. This is important for useful for long cases, for example, when you're repeating the dose of antibiotics. This part here is deficiencies, and this will be a list of deficiencies, or basically things that you need to complete before you can finalise your chart. We'll see a bit more of that when we go through the chart and start actually documenting bits and bobs. You can move this in, you can move this out, you can see everything, all the monitors are on here, and you have a maximum of 8 rows. So once you get past the 8th row, you need to start moving it down, and this is just for space. Gases will come up here, monitors will come up here, you'll see extra boxes come up when you start prescribing fluids. This is the observation section, so your heart rate, your blood pressure will all come on here. And the action section is down at the bottom. And can you see, if you hover over, that is our macro that we created. So then it falls onto this action state down here. If I click on this arrow, it will remove this whole section. If I click on this arrow, it will bring this section back. Over here on the right hand side, you can hide actions, you can hide macros, you can basically hide things on here. It's not a terribly useful functionality, I would ignore that. And this is our range of blood pressure, so it's easy to see numbers when values or data points are added on. You can always hover over the points and it will tell you the exact number itself. So as we have one computer bolted onto the anaesthetic machine in theatre, if you are anaesthetising in the anaesthetic room and you want to pull data from the anaesthetic room, that's absolutely fine. And then when you move into theatre, what you need to do then is you need to dissociate from the anaesthetic machine in the anaesthetic room, and you need to associate to the anaesthetic machine in theatre. And this is very easy. Remember those blue boxes that we clicked on initially? So if that was my monitor in the anaesthetic room, I have now anaesthetised the patient and I've moved through into theatre, and I want to now associate to the theatre anaesthetic machine. What I do is I go to Task, I go to Associate Devices. It will tell me that I'm connected to this device, which is our anaesthetic machine in the anaesthetic room. So what I do is I highlight it and I remove it and press OK. and now I've dissociated from the anaesthetic machine in the anaesthetic room. I then go back into Task, Associate Devices, and then I click on the device in theatre. So say this is my theatre device, and then press OK. And as soon as I've done that, and it will go back green, it will then start pulling data through. So that is how to associate from an anaesthetic machine, come through into theatre, and reassociate back to the anaesthetic machine in theatre. Data will be pulled through from the anaesthetic machine onto your record, and it will be populated here and also here. You can change the data that has been pulled through at any point if it is incorrect. For example, if the SATS probe falls off the finger and at that particular time the computer pulls that data, it might record SATS of 40, 50. You know that is not correct. You can click on the value, you can change it, and it will not leave a data stamp of the previous value. So you can change any of the values to make sure it is an accurate representation of the data recorded. So you are not any data that is pulled can be changed and manipulated by yourself to make sure it's accurate. So what I'm going to do now is we've got our patient in, they're anaesthetised, we've associated to our theatre anaesthetic machine. We are pulling data. I know there's nothing here at the moment, but let's pretend data is being pulled. What I'm going to do now is I'm going to work through my macro to-do list and start populating data, and we're going to prescribe a few things, and you can see how it looks on the anaesthetic chart. So I'm going to go over to my to-do list, which is that list that we started. Let's move to the top. If you click on here, it will highlight some buttons down here. Edit it will allow you to obviously edit anything. If you execute it, it will pull whatever has been pre-populated down into your action bar. Okay, so let's say we started our anaesthetic, but we started it at 10:15. Okay, so anaesthetic start, I would edit it, and this is a data stamp, timestamp, so I just type in 10:15. Okay, and because that's when my anaesthetic started, what I find the easiest is if I do a Control-C and copy that, so I know when I can prescribe all my drugs to this time. If I press OK, it will just keep that data stored here. So if I go back into it, if I press execute, it will then pull data and down here. So it's now executed and pulled data. So if you press OK, it will only save it. You have to execute it for it to be officially recorded. A shortcut is also that you can drag and you can drop if it's at different times. The next thing is nitrous oxide. I'm not using that, so actually I can either leave it on my to-do list or I can delete it off my to-do list. So you can delete things as you go. Monitors and safety. So I'm going to click on that. Okay, I'm going to then select the bits which are relevant to the case. Blood pressure cuff applied, left arm, upper arm. We're using a tympanic. We're monitoring via anaesthetic, end-tidal anaesthetic. Again, I can copy my timing, or I can manually type, or I can drag, whatever you find easier, and I'm pressing execute to drop onto my list. So this is how you fill in actions. So it's the same with the cannula. Let's fill a cannula in. So it was a hand left 18 gauge according to AAGBI guidelines. We put it in theatre. We used some ChloroPrep. We allowed it to dry. And see all these other tabs here. If I do not fill them in, it will not pull the data. Okay, so let's pop that to there, execute it. So can you see ultrasound guided? Yes, no, I've left it blank. So when I execute it, it falls on here. And as you can see, all that information has been recorded, but things about ultrasound and all those other bits and bobs hasn't pulled through. So if you do not complete it, it will not pull through. Let's prescribe some drugs. So this is the same for all these actions. Let's prescribe some drugs. So fentanyl, we're going to edit it. Okay, I'm going to put my time in. Okay, again, you can drag whichever time you wanted. Now, new will always crop up if you've never given that medicine before. Once you've given fentanyl, if you then give more fentanyl, new wouldn't come up there. It's just saying that you've never given fentanyl before. If there is any allergies to fentanyl, you would see an allergy status as well, just to remind you that this patient might be allergic or is allergic to whatever drug you are trying to prescribe. You can prescribe drugs in two ways. The first way is a bolus, the second way is an infusion. So things like your phenylephrine and things, they can be prescribed as infusions. So fentanyl is a bolus. We've got our concentration up here. My dose, I can either type it in as 100, or if I wanted to, instead of typing, I could use my touch screen and type 100 in here. We've set the route to intravenous. The blue bits here can always be changed. So this is useful for other drugs, not necessarily fentanyl, but if you say you wanted to change that to milligrams, you could then come up here and put milligrams. And then we've got the time, we want to execute it, and it will drop onto our medication here with a dose. If at any point I want to edit this and say I actually gave 50 micrograms, hover over it, right click it, modify. Let's change this back to micrograms. And let's change that to 50. And you can see I've changed it. You can always change by going up to medications. You can see that you've got different sections up here. So that right click modify is exactly the same as these modify, where you can then click on it and then change it. What else shall we prescribe? Let's prescribe some atracurium. So we want to edit it. We want to give 50 milligrams. I want to backdate it to the induction, and I want to click execute. You can see it drop on here. Okay. So then we'll start working through our list. So that's how to document drugs, bolus drugs. If I wanted to document an infusion, let's take a phenylephrine infusion as our example. So let me see if I've got phenylephrine on my to-do list. Now I probably don't. No problem. I'll go back into the medication section, so I can either go here for medications, or I can come off of my to-do list and click on here, click on medications, click on vasopressors, click on phenylephrine. Okay, now bring up this box. So phenylephrine, we want it as an infusion. We want 10 milligrams in a ml, and we want to put it in saline. You can ignore the 100 ml, 10 ml ampules, 100 mils. We just needed the actual constitution, the dilutant that you're going to add it in. You don't need to worry about this, the 100 mils, because you can change that. So just click on whatever you want to dilute it with. So sodium chloride, and I'm going to put it in 49 mils of sodium chloride, because I've got 1 mil with my phenylephrine. So I've got 10 milligrams in 50 mils. Okay, and I can start it at 10:15. So I'm just doing a Control V to copy that in there, or I can drag my infusion to start at a different time. So let's start it at 10:20. Okay, green means go. You'll have a yellow part when it's infusing, and then red is when you stop it. And let's say we started it at 10 mils an hour. It's intravenous. we're going to press OK. So you can see now we've got a phenylephrine infusion running. All the infusions will, with time, will calculate a dosage here. And we started it at 1020. When you hover over and put your mouse into the box, you can see that you've got your sodium chloride, 10 milligrams and 50 mils, and it's running at 10 mils an hour. Okay, so that's how to prescribe an infusion. What I'm going to do now is I'm going to show you how to create your own specific macro. So to do this, go to Task, Maintain Macros, and what I want you to do is I want you to copy one of the preset macros that I have already created. So you say GA volatile. Okay, you can then name it whatever you want to call it. Make sure you save it into your personal macros and make sure it's highlighted to your name. So that GA volatile, that list of to-do list is all down here, and this is where you'll see the power of this function. So let's say we want to fill in a IV cannula. So let's go down to the peripheral IV. You click on edit here, and this is where you can pre-fill lots of information. So anything that you write down all the time, they can already be pre-filled. So I could save that now, and then every time I click into it, these will already be pre-filled. So all you need to do is hand left 14 gauge, and that's your cannula documented. It's exactly the same with any medicines. So you can pre-populate 1 gram of paracetamol. You can pre-populate 50 milligrams of rocuronium. If you want to add or remove any of these of this macro, you would just highlight it and then move it back off the list. Again, if you want to add anything to the macro, you would just click on, say, let's add some opioid analgesics. Say you want to put some diamorphine on here, you can then just move it onto your to-do list, and it'll drop down to the bottom of the to-do list. Now you can always click it like that, and you can move it up in a different order, and you can select, this says execute or to do. Execute means that once you execute that macro, whatever is pre-filled here will automatically occur. So if you ever want to not do that, you click it in the to-do list. As you can see, if you go to the top, all the monitors are already set to execute automatically. So that is how to complete your own macros. What we want to do now is we've finished our case, we want to finalize the case. So click on to finalize first. But as you can see down at the bottom, do you remember we talked about these deficiencies? It will never let you finalize a case if you have something outstanding, and it's generally an infusion. So we know we've got a phenylephrine infusion going at the moment. So for me to finalize this case, I would need to stop this infusion. So I've just right clicked, stop infusion, and then this will then, if we refresh, fall off our list. So if you go to finalize, the first box will say, are you sure you want to stop pulling data from all these? And you'll say yes, that's great. And it'll, again, the first thing it'll do is it'll give you your to-do list. It'll say, oh, hang on, are you sure you want to finalize? You've got lots on your to-do list that you've not completed. And you say, that's absolutely fine, I want to ignore them all. And then to finalize your chart, you always need to sign it first. It will never let you finalize without a signature. You can sign it if you're with anybody else during the case, another trainee and a consultant. They can also sign the record, but you only need one signature. So click sign. So the first time you use SA Anaesthesia, what you need to do is put your username in here and also put your username in the password section. Okay, this will then prompt another box to change your password, and you can then add your own password, which will just be specific to SA Anaesthesia, and it will remain the same password. So every so often you'll need to update your passwords for PowerChart for data protection. So when you do that to log on the computer and things, that will be changed, but your SA Anaesthesia password will remain the same, and it will remain whatever you set it to when it prompts you to do that. And then once you've signed it, your name will come on here, and then you click finalize, give it a couple of seconds, and then it will upload into the patient's record.